Healthwatch Norfolk is keen to hear your views about pharmacies, what works well for you, what could be improved, and your experiences. But what happens when your GP or doctor prescribes medication? What's the process? What could delay it? And how can we all help our pharmacists? Healthwatch Norfolk went to find out.
The doctor decides what you need on prescription wise, then he decides to send that prescription predominantly electronically to the pharmacy of the patient's choice. So if that's received into the pharmacy, we then download the prescription from what we call the NHS spine, and we process that prescription. So that's the official legal document for us to dispense against. That process then in the pharmacy is then we label the prescription so everything is recorded on what we call a patient medication record, a PMR. We dispense it, we put the instructions on, any advice and warnings. We have that checked by a technician and a pharmacist. There's two types of checks. There's the what we call the accuracy check, so actually making sure it's the right product, the right strength, the right dose that the doctor's prescribed for the patient. That other side is the clinical, the other one is the clinical check, which is what the pharmacist does. They're looking at things like drug interactions. Is the product suitable for that age of the person? Is that product licensed for the indication that the doctor's prescribing it for that person? So there's a lot of safety clinical checks which go on behind the scenes. A lot of medications on repeat, that's all been done, so therefore it's routine, but it's the acute prescriptions tend to be the harder ones, so we're making sure it is safe. We are the last point of safety for the doctors and to the patients before it gets to the patient. So we spend a lot of time checking, looking to see where those problems may occur, and that is actually is appropriate and safe for use for that patient. And it's then handed to the patient when they come into the pharmacy. So some people will come in immediately if it's for items of urgent need. Some people will come back maybe a day or two later because it's a regular repeat. So we store the prescriptions and we hand it out to the patient, checking names, addresses, so it's the right person. That is the ideal scenario. Once that prescription is then handed out, it then gets processed and it goes electronically to a central area where it's actually recorded for auditing purposes.
So what are the timescales and how long, on average, would we need to wait, depending on the urgency of the prescription?
So as soon as the doctor prescribes something and releases the prescription, that then hits the pharmacy immediately. So workload is the important factor, that if it's an urgent acute prescription, pharmacies will actually deal with that as soon as they possibly can within the same day. If it's a repeat prescription, because of the sheer volume of prescriptions coming down, we plan our work. So that might take a day or two to process in a safe and methodical manner, especially if we have to order medication in.
Sometimes this happens, but it doesn't mean your prescription is necessarily waiting for you at the pharmacy at that point.
And I think we're very automated in healthcare and GP practices. A lot of times things are processed, a message will go out to say, yes, things are ready, but that's coming from the GP practice, not from the pharmacy. Just because they've said they've done a prescription doesn't mean say it's ready for collection at the pharmacy. We have received the prescription, but we've got to go through our processes, our checks, our procurement methods. So sometimes it can actually be a miscommunication and confuse patients as to why it's not ready.
We're going to the pharmacy often because we are unwell, and it can be a stressful time.
People come into the pharmacy because they're not very well. And when you're not very well, you're not in your best mood anyway. So sometimes people can be very anxious, can be very worried, and just can be not feeling very well. So they don't mean to take it out on the staff, but it's quite easy to get frustrated. And I think that's where the miscommunication comes in. So if it's an acute immediate medication, we will deal with it as soon as we possibly can to deal with that. If there's a delay, then yes, we've got to explain that delay to patients. And that's why we're saying if people can allow an extra day or two before they pick their prescriptions up, if they're able to do that, it just helps that process. The ideal is we ask patients to order their regular review prescriptions a week before they need them. That then allows for bank holidays when places are closed, it allows for shortages, it allows time planning and management of their prescriptions. So 7 days before it's needed. Now, we all know we forget and we will endeavour where we can do, but we just people, if they can order 7 days before needed, it allows the process to work. If they've got a concern, and they've forgotten to order something, which we all do, just talk to us and say, look, I'm really, really sorry, and we'll do our best. Don't just assume just because you've ordered it, it will be ready when you want it at that moment in time because you've run out. Talk to us and we will do what we can.